Today we're talking about the leading cause of infant hospitalizations in the US, RSV. Stick around because we're not just talking boring textbook definitions here, we're going to break down a real-life scenario that you might actually encounter in the field.
You're called for a 2-month-old male with trouble breathing. The patient was born full term and has no past medical history. The parents tell you he's had a runny nose for 5 days, and for the past 4 days he's developed a cough. 2 days ago they took him to the family doctor who diagnosed him with RSV. They gave him albuterol and budesonide inhalers and sent him on his way. The parents have noticed his cough getting worse, and they say he's not breathing right. You walk in, see a tachypnic, ill-appearing 2-month-old. You immediately notice nasal flaring and subcostal retractions.
And this kid is working way too hard. So what are your treatment priorities? Nasal suctioning is a good start.
Clear those airways because remember, kids this young are nose breathers. If your training and protocols allow, nasotracheal suctioning may be indicated. In many cases, suctioning alone can make a huge difference.
Here's Jamie Perlow, one of our critical care transport nurses, to show us how.
So one of the most important things to do is suction, and there's a couple different ways to do this. We have these little suckers. They're like this big. They actually do work really well. You never want to hold the port going in. You only want to suck going out. And you just go in until you really can't anymore. You don't want to force it too much, then you're going to obviously cause some bleeding and trauma. And then you're just going to suction on the way out in kind of a circular motion. And you're going to want to make sure you do both nares. You could use this also for oral suction if you needed it. Obviously, you always want to do the mouth before you do the nose. Now, if this doesn't quite get it, say your secretions are really thick, something like that, you can always just take your flush. You do not want to put a lot of saline in these kiddos. We're not trying to, flood them with water or anything, but a little bit of salt water is going to help break up those secretions. I kind of tag team this. As I'm inserting, I just give them a little bit of saline, and then I just want to suck that out. And that's going to help break up those secretions. And again, you're gonna wanna go through both nostrils. Say you can hear this kid's gurgling. It sounds like it's a little bit deeper, these secretions. They're not stuck in your nasal cavity. You have deep suction. And the same thing with this. You can use a little bit of salt water to help break up those secretions. So this one you get to go a little bit deeper with because it's a much thinner tubing. And again, you do not want to be holding your port as you go in. That's only for exit. But as you can see, I can go much deeper with this. So then again, I'm coming as a circle coming out. We're very lucky we have Vapotherm to transport, but basically any of your high flows, they're going to be humidifying these kiddos. So it's going to be causing the breakdown of those secretions, and they're gonna need suction a lot more. It's not unusual for me to suction 2 or 3 times transporting from one hospital to another.
After you've got the kid all cleaned out, you'll want to check the blood sugar.
Hypoglycemia can happen quickly when kids are working hard to breathe.
Let's also consider steroid treatment.
You might go for Decadron at 0.6 milligrams per kilogram IV to help reduce inflammation in the airways.
Next up, let's look at his fluid status.
RSV and other viral illnesses can lead to dehydration, so we're talking a 20 ml per kg bolus of lactated ringers or normal saline. Keeping that fluid status up is essential. Depending on your protocols, you might want to give supplemental oxygen with a traditional nasal cannula or high flow. The goal is to improve oxygenation and decrease the work of breathing.
You'll notice that we haven't given albuterol.
Studies have shown that nebulized bronchodilators will not improve oxygen saturation, reduce duration of hospitalization, or time to resolution of the illness for patients with RSV and bronchiolitis. Positioning also matters. Get that head of the bed to 30 degrees. It opens the airway and makes it easier for the little guy to breathe.
So there you have it, RSV treatment for paramedics in a nutshell. Assess, treat, and get them to definitive care.